Looks like we have a good turnout today. And again, welcome to everyone. I appreciate you being here, and we're going to go ahead and get started. I'm Joy Hogge with Families as Allies, and I'm here on the screen with my coworker, Karina, who will be monitoring the chat. We really appreciate y'all joining us today. This webinar is going to touch on a lot of different topics about what does this whole thing about flipping the script mean, and what can we do with this in the real world, in our real lives with our real children, the real programs that are working with them, and then looking at a couple of policies in the state where there might be some chances to flip the script in a good and healthy way with those. And some of you may know that in the past, I don't even know if it's been a week. I think last Friday, we learned about some changes that the Division of Medicaid is proposing in their policies. And we're going to talk about one of those today. And there's a fair bit of information to take in with that. So we tried to boil it down to some things that would be helpful to touch on today. But if any of you have questions about that, or any of the other things we talk about today, of course, you can get back in touch with us. So we'll go ahead and get started. Y'all know we always start with our goals, and that by the end of this session that you'll be able to describe the difference between awareness and acceptance. Those are two words that are commonly used during, May is Mental Health Month, and awareness is often used in association with weeks or months looking at a particular cause. But we're going to talk about, is that really the word we want, or do we want acceptance? And what do both of those mean? That you'll be able to share ways both providers and families can use acceptance as a helpful way to make services more responsive. And in this particular webinar, we're going to focus more on mental health providers who are providing services to families, but what we're going to talk about would apply to in any system, and that you'll be able to demonstrate understanding of how programs can be set up to foster acceptance, and be able to describe two policy issues in the state related to flipping the script. Now, there's definitely more than these two, but trying to keep the webinar within an hour, we're going to focus on two today. But those of you who are aware of other policy issues, I hope the concepts and things we talk about today will be helpful related to those. For those of you who are not familiar with Families as Allies, and for those of you who we always want to remind what we're supposed to be doing so you can hold us accountable, we're the only statewide organization run by and for families of children with behavioral health challenges in Mississippi. And we describe behavioral health challenges pretty broadly. So it can be a traditional mental health challenge, dealing with another disability, having experienced trauma, going through things in a system that place a lot of stress on the child and family. So there's a need for added support. So as families, we support each other. We do a lot of parent-to-parent support in different ways. And then we work together at the systems level in partnership with each other and the different groups working with us to make things better for our children. And I really hope that the things we talk about today will give us some both philosophical but very practical ways to look at making things better for our children, because we want all children, that's our vision, to have the opportunity to reach their potential and succeed. And our mission is that families are partners in their children's care. We value as an organization, and these are the things that we strive when we're working with the systems to support them in valuing too: every child and family, excellence, partnership, and accountability. And I think today we'll be reflecting a fair bit on accountability. These are our core beliefs about families. And this is also what we support the systems and others working with families in believing about families. We believe you as a family know your child better than anyone. You are your child's strongest advocate, and we believe that systems should follow laws and policies about families and children's rights. And that's one reason we talk a lot about policies, is they should be set up to be supportive of the direction that families believe is most supportive of their children. And when we say families, we are typically thinking about parents or whoever are raising that child. But a family is made up of more people than that. So for youth, teens who are involved, who can make decisions about their own care or give input into that, and even children who are younger who are ready to do that, that we believe that about them too. That is why we frame that as what we believe about families, not just parents. And parents, of course, we mean that more broadly, and that's anyone, parents and caregivers, anyone who is raising a child, because sometimes that may be the grandparents, other extended family, a foster parent, or someone, the child themselves, like what the teen has chosen. What we mean by families will be partners in their children's care is that the system of care, so all those entities out there working together for children in Mississippi, will be family driven. And we review this definition a lot because it's very easy to see this slide and go, oh yeah, I believe that. And then when we get out there doing this work, it can be really hard to see how this actually applies. And when things aren't necessarily set up in a family driven way, how do we move them from move things from being less family driven to more family driven? So family driven means families have a primary decision making role. So they're not just sitting there agreeing or signing a piece of paper in the care of their own children. Now, this next part is going to be really relevant to what we're talking about today, as well as the policies and procedures governing care for all children. So today we already know we're going to be talking about some policy things that are going on in the state. We want families to have the information they need to give input into those policies. We're not going to say what we think that input should be because they're the ones who know. Because remember that other slide? They know their child better than anyone. They know the things that are going to work for their child. But it's important that every family have that opportunity to give input if they want. It's also important for everybody else out there working with families to have that opportunity and to have the information they need to honestly reflect on that. And these are the ways all of that is manifested. And you guys know this is one of our favorite pictures at Families as Allies, because family driven really comes down to this. When you get in a car, you typically know where you want to go, the route you want to take, how much effort you're willing to put in it. If it's a day where you just want to be lazy and drive a little bit, or maybe relaxed would be a better word, or if you're ready to put the pedal to the metal and get where you're going as fast as you can, and you know who you want in the car with you. Families know that too. They know where they want their children to end up. Children typically know where they want to end up. Like, I want to be able to be in this club. I want to be able to play on this team. I want to be able to have these friends. Things like I want to graduate from high school. Families know where they want their child to end up. They may not know that they may need some information about different routes they can take so they can choose what they want, and other information about how people can help them on that journey, but they know those same things. So respecting that and not trying to get families to choose a different path, but to support them in going where they want to go with their children. That's basically what family driven means. And that also means at the systems level, really listening to families and saying, and program level, what do you want? And what would help y'all get to where you want to be and go with your children? Okay, so now we're going to get to this idea of flipping the script. Is there anything in chat besides the introductions, Karina? I went through that first part kind of quickly because we've got a lot we're going over today.
No, ma'am, it's just introductions.
Okay, well, I'm glad y'all are all getting to know each other, and y'all just you guys keep doing that, because it's always helpful to know who everybody is. And maybe soon we'll be able to get to do some of this training in person, but we will probably continue these webinars too, because they seem to have been something people like. Okay, so I mentioned that May is Mental Health Month, and sometimes you hear it's called Mental Health Awareness Month, but there's been a real move towards just calling it Mental Health Month, which is interesting. And then the first week in May is Children's Mental Health Awareness Week. Now, I know we're in the second week of May, but our parent organization, the organization that we're the state chapter of, the National Federation of Families, which is like 150 chapters of groups like us that are doing this kind of grassroots work across the United States. The Federation of Families decides the theme of Children's Mental Health Awareness Week, which has typically been, which is the first week in May. But we're taking their theme, which is flip the script, and we're talking about it throughout the month of May because we thought it was such an interesting theme. And there's all different kinds of ways it can be used. This is how the Federation described it for the purposes of last week. This, and that stands for, I don't like abbreviations, but there's probably other ones in here, Children's Mental Health Awareness Week. We hope to educate individuals and communities about the importance of teaching children and youth that caring for their mental health is a vital part of living a healthy, fulfilling life, which is a great message because mental health is just part of health. And, we don't typically go around saying you have your physical health, where you have your cardiac health, and then you have all your other kinds of health. We do that with mental health. Like you got your mental health, and then there's all your other health. Mental health is really just part of health, and it's part of supporting us in a much more holistic way. And I also like that it's an emphasis on health instead of sickness. We want to support our children. So whatever is healthiest for them is what they get. It's not just about getting rid of things that are bad. That experiencing mental health challenges during their lifetime is not uncommon. And that's true. 1 in 5 children will. And it's not just okay, but it's important to ask for help when they do, and to offer acceptance, support, and respect for others who have mental health challenges in their lives and community. Which I think we can especially appreciate that last one, especially if we have a child who has mental health challenges, knowing how it is for those around them, for them to have people around them who accept them as they are and not as someone who is different or in a specific category. Now that's where we first start seeing that word acceptance as opposed to awareness with what the Federation did. Now, I just want to stop for a minute and give y'all time to respond in the chat about what do you think about the idea of mental health awareness and mental health awareness campaigns. What's good about them? Do you see anything that's not so good? Any concerns? How do mental health awareness campaigns, maybe even the points in this one, how do they strike you? So what are your thoughts about the strengths and weaknesses of mental health awareness campaigns? And I'll just pause for a little bit and let y'all share your thoughts. And I'm actually going to take a sip of water while people think, and I hope type.
We have one chat. It's good because bringing awareness to things that people tend to be afraid to talk about helps to bust that stigma. They can be useful in reducing stigma. Good because united for a good cause. That's good.
Okay. So those are some really good points about awareness campaigns. And there have been, I think Children's Mental Health Awareness Week has been going on. It's been going on for a long time, like probably at least 25 years. And we probably all, I think I have a drawer full, and we have a cabinet full of these green awareness ribbons because we haven't been able to do as many things out and about the last couple of years. And then this is just the idea of, there's been lots of emphasis on like getting information out, which has been a good part.
Families are receiving more services because of the campaigns. I think good. I think it can help us to share with others how to support and help people they know who are struggling with mental health issues and help those struggling get the resources they need. These are good answers.
Okay, yeah, so lots of good information. Now, I just want to throw this out there. Can anybody see any downside of awareness campaigns? Or maybe a need for a next step?
Yes, and to also help those who have family members that suffer to understand.
Okay. All right. So you guys are bringing up a lot of good points, and maybe also pointing to some things that we can think about next, because there has been a lot of emphasis over these past 25 years on making people aware that mental illness is just as real as any other kind of health problem. And then also the thinking that the more we can get information out to people, the better they will do. If they have information, then that will help them get the information they, get the resources they need. Now, I want to bring up a couple things. One is, I'll just tell you a story. About 3 years ago, I had a chance to be on, at that time, the Attorney General was Jim Hood, and he put together this mental health task force. And I was on it, which I really appreciated, because we had sometimes had some like question some of the things he had done related to some other things related to mental health, but I was happy to be on there. And the group really talked a lot about awareness, and if they could just get enough information out to people, and they kept talking about brochures, then everybody would know where to go to get more help. And I brought up the point, well, what if the place they go to, they don't find that helpful? What if it makes them feel more stigmatized? What if it makes them feel more alone? And is that place just going to turn around and say, well, that person just didn't understand, or they didn't do enough to get over their own stigma? And what if there's not a place where someone can go? What if the kind of information and support they need doesn't exist that much yet? What do we do about that? So I just want to start, and Stephanie made a comment. I saw one comment. We must stress that all of us have mental health wellness. If we only focus on when someone is seriously mentally ill, we could be adding to the stigma. Yeah, like that's something that just happened to that person. It's not about all of us realizing this is something that applies to all of us, that we all need to be focused on mental health as part of health. Okay. This is a good point. Not everybody reads brochures on what works for one person. I'm sorry, I'm reading instead of you, Karina. May not work for another. Okay, now.
These are some good comments.
Yeah, there's a lot of good comments in there. These are some possible problems with awareness. Is the idea that when I'm talking, like when I say, what if what they really need isn't there? It can create, and this may be a new thing to think about. It can actually, if it's about you just need to be aware, you just need to have enough information, you just need to take this and go get the help you need. Well, if that doesn't work, because maybe those resources aren't there or whatever, that can make families feel more blamed. Also, we don't, now I'm not, it is good. This is one very, very good thing about awareness campaigns, is they have gotten a lot more information out there. They've helped people realize that mental illness and mental health are real things. But when you think about it, we don't have a month typically where we are telling people, when you go to the doctor, you need to make sure that they check your heart, and you need to make sure you're getting your pulse checked. Those things just happen as a part of routine health care. We don't, with other illnesses, we don't put so much pressure or so much responsibility on the person themselves to understand that they have an illness. Now, on all illnesses, we should be sharing information about what is helpful, but things are set up so it's more likely that problem will be discovered if they have one, or they will be supported like in maintaining their cardiac health, because their doctor, when they go to the doctor, is just going to talk to them about things that will help them in that way. So one possible issue with awareness campaigns is they can make families feel more blamed, because it's like, it's on you. We gave you your brochure. We've been talking about mental illness, to go figure this out and go get the help you need. And that can make families feel more stigmatized, and it can allow the system itself to blame things on, well, that's just them not getting over their stigma, when the real issue may be, and this is the second thing, it can let systems off the hook for how they might be stigmatizing. You know, just the fact that people typically have to figure out and access and find this whole separate system to get help, as opposed to getting help where their primary care provider is, or where they're used to getting health care, can be stigmatizing. And if the right kinds of services and supports aren't set up at that place when families get there, or a person needing services gets there, and so they can't get the help they need to live in the community the same way other people do, that can actually be discriminatory. So that if all the emphasis is put on what that person needs to know and understand, as opposed to also how that system needs to change to be responsive to that person, that can end up being discriminatory. It can also, and somebody brought this up, allow people who don't perceive themselves as having mental health challenges to see this issue as unrelated to them. Like, we told that person what they needed to do to go get help, and they didn't do it, so that's their problem. As opposed to realizing that mental health is part of health and something that should be incorporated into all of our health care. And when the emphasis is just on like that personal awareness of that person and them getting over their stigma, that doesn't necessarily lead to policies that change the mental health landscape in ways that are most needed. So it may lead to things like more emphasis on, say, mental health first aid, and that's great. But again, that is emphasizing what in the end result of that is the individual people who need the support getting it, as opposed to how can the systems change. So maybe people are less likely to get in a situation where they need that kind of help. Now, I know this is a different thing to think about after all these years of awareness campaigns. So I just want to pause here and see if anybody has any thoughts about this, because you may be thinking, well, that doesn't make any sense, or I disagree with that. But any thoughts?
We have one comment: information is good, but once I get the information, then what?
Right. Okay. So maybe this webinar will give us a starting point for a conversation about then what. Now, I'll tell you this in case any of y'all are interested. The National Federation had a couple of large gatherings last week, and one was the executive directors of organizations, like of all the chapters. So I was at that one. And some of you may have been at the Flipping the Script one they did last week. But we had this conversation about moving from awareness to acceptance last week at the meeting for the executive directors. And one thing that came out of that is a commitment on the part of the Federation to develop a national platform about moving from awareness to acceptance, which is much more about creating a system and even a society where there is acceptance of our children as our children and less discrimination, as opposed to putting so much emphasis on individualized people getting over stigma. So if that's something anyone's interested in, that's a process that's just now getting started. Now, this is a big secret, the big secret behind all this. And this is just one thing I'm going to share that I think helps reflect on this kind of from a personal perspective. You know, I'm a mom of a child who has special healthcare needs, and he's had other kinds of challenges, including related to mental health and dealing with depression and anxiety. And I will tell you, like, if I told you everything that had happened to us, which we're not going to do because we're already kind of in a time crunch with all that we want to cover today. But my guess is, if you listen to me, you might be thinking about, well, y'all could do this and you could do that, and your son could do this, and this might help if y'all did that. That's just a natural human response. I will tell you, and my son's getting ready to turn 21 next week. So I've been dealing with this for a long time. This is my big secret. The thing I most want, and that I have wanted since I started dealing with his disability, isn't about what I wish we could change. We're doing quite a bit, and most families are doing the best they can, whether it looks that way from the outside or not. What I really want, my big secret, is for all the people out there to change. Our biggest barriers have been from other people not listening to what we say we need, and not believing me when I say, well, this is what would really help. Because a lot of times they'll come back with, well, why don't you do this and why don't you do that? And, you know, I know I'm just like those beliefs. I know my child better than anyone. He knows himself. We know what we've tried, what works, what doesn't work. Our biggest thing is just listen to us. We know. We've been spending a lot of time figuring this out. We may not be perfect, but we know what works for us. So please listen to us about what works. And you're not, like, if you include him in something, don't come to me and act like you should get a Nobel Prize because, you know, you invited my son to an event that your family's doing. I think he's a great guy. I think you'll enjoy him being there. But if you really want him there, don't act like you're doing us a big favor. And in fact, come to him first. When he was little, come to me first and say, I really want him to be there because I think all the kids should be there. What can I do to make it easier for him to be there? And don't assume you know. So that's just a big secret. And I think most families feel that way. Our biggest challenges aren't us trying to figure out what to do. It's being believed and having people listen to us about what would most help our situation. So these are just, and that's really about accepting us and accepting our children and us working together so they can have those same chances that other children do. So that's what we mean by moving from awareness to acceptance. And I'm going to go through some things just to get people thinking about what that might mean from different perspectives. What does that mean if you're a parent and you're thinking about you and your child? It means you have the right, and it's in your child's best interest to expect acceptance. So if you go to a school, if you go to a mental health center, if you go to your healthcare provider, you have the right, and you're doing the right thing for your child, to expect that they will be accepted in that environment just like any other child would be. Now, that may not happen, and we all know that, and there may be challenges to work through, but it can help to start with that in your mind, that you know it's okay to have that expectation that your child should have the same chance to do the same things the other kids are doing in that situation and be supported. That doesn't mean he's going to succeed. Not all children are going to succeed in every setting, but it's okay. And it makes a big difference to just start as that child's parent with that idea that my child has just as much right to be in whatever the setting is as anybody else. and to have the same chance of succeeding in it as anyone else does. As a parent, learn what you can and want to. That's always good. Sometimes there's a lot of emphasis on, well, mom, you just need to do that, and you need to do this, and you need to go read that book. You can listen to all of that. Information's good. So learn what you can and what you want to, and listen to feedback. Some of it may be very good, but remember, those things don't take the place of acceptance. So if you are looking for a place where you want your child to get mental health care or any other kind of care, and most of the emphasis is on you being told what you need to do differently, and there's not, you don't have that feeling of they accept my child, they think my child has the same rights to be here as other children, and they want him to have the same chances as other kids, that's a time to really reflect if you're really in the place you want to be. And along with your child, decide what you want for them in the short term and long term. And remember, it's okay to expect those working with you to support those things. Just because my child has a disability, it doesn't mean I want different things for him. I wanted my child, everybody knows this because it took a lot of people getting in and out of our car to be able to go to college. He's a senior now. And y'all know this, he wanted, a lot of you, he wanted to play baseball. I really didn't know exactly how that was going to work, but we were co-driving by then. He's playing baseball. We didn't sit around and go, well, we want him to have less of this symptom. We wanted very normal things for him. And so we needed people in our car that understood that. And it's okay to expect those working with us to support those things. There's probably going to be crises along the way. Have a crisis plan before you have a crisis, because at that crisis, it is a time where we focus on symptoms and making them go away. But if we have a plan for it, including how to keep it from happening, we're more likely to be able to focus on those things that let our child do the same things that others do. Ask the people working with you, if you're a parent or who are working with your child, what expertise or experience they have to help your family reach the goals you have. You know, we wouldn't typically, when we go to a surgeon, if someone has told us we need surgery, we ask them about their experience. We ask them how many times they've done that surgery. It is okay, and it is a good idea if you are going to a mental health provider and ask them, what experience do you have helping families like mine or helping a child like mine reach these kinds of goals? You know, do you hear stuff about evidence-based treatment? Really, all that's saying, and I apologize in advance to the clinicians on here for how I'm getting ready to explain that, is that whoever's working with your child knows how to help them with that problem in a way that we know demonstrates outcomes. That it's not just about going and seeing someone. Trust your gut on the relationship with those who are supposed to be supporting you. Does it feel like they are? And remember, especially as your child gets older, your child's perspective may be different than yours. Keep checking in. You know, I mentioned my child's turning 21 next week. I am sure it is no shock to any of you all that he often has different expectations of what he wants than I'm thinking. Now, and as he's gotten older, it's become much more about supporting him in getting the things he wants and his goals, and to live in a world of acceptance. But we've got to keep checking in with them about what their goals are too. And also realizing it is normal for parents and children to have different goals, and to figure out ways to work that out along the way. And think about, I think there's a typo there, where you want mental health support other than in the mental health system. Would it help you more for whoever's providing the mental health support to perhaps, you know, work with your child's teacher, or if you got that, were able to get that care in a primary care setting where your child was already going to the doctor. So, and if y'all have any comments, please feel free to make them. There is a lot of information in here, so I'm just hitting it, but we can stop and talk about anything. Or if you have questions or a different perspective, please type those in too. What does this mean if I'm working with families? So if you're that mental health provider that family's coming to, and we just told them all those things, what does that mean? If you're a mental health provider, and I think these apply to other areas too, stay focused on what the family wants in the short and long term. Ask them, what do you want right now? What brought you here? What do you most want? What do you want for your child in the long run? That's really important. It should, and we talk about this, and I think Henry's on here. I'll give him a lot of credit for this, that question should frame everything else that happens. The goal isn't to reduce symptoms or to solve problems, although those things will probably happen, but it's not what do you want to get rid of or what problem do you want to fix? It's what do you want in the long run? And how is whatever's going on now keeping that from happening? And how can we support you to get to that long-term goal? Not just to get rid of whatever's happening now. Recognize and be responsive to the ways in which systems may be stigmatizing or discriminatory. Maybe even your own system is doing it without even realizing it. If you don't have the array of services that families actually want, if you're not open at the hours where it's easiest for them to come, this is a common one. If families are telling you about things that are going on at school, it may very well be that the school district is doing something, whether they realize it or not, that is discriminatory and not in keeping with the laws about how children with disabilities should be responded to. It's incumbent on those working with families to at least be aware of those things. That's one reason we do a lot of training with providers and education advocacy. Remember that just because a parent is asking for support for their child, that doesn't mean they're asking you to change them. We have to ask, I know, because I've been doing it for 21 years. Well, not so much the last few, but because of that, that's more about my child and what he's doing. But I've had to ask for help and get a lot of support in a lot of different ways for my child over the years. It's a vulnerable position to be in because I want him to get that help. I wouldn't necessarily be laying my life out in front of those same people if I didn't need to get the help for him. So I don't really feel like that means it should be open season on looking at me and how I should be doing everything better. Now, I'm willing to listen to ideas, but I'm not there for you to take me apart. I'm there because I need help for my child. Those are two very different things. Now, you may notice some things and you can share information and perspectives, but not your assumptions and judgment. And ask questions to help you understand. Like if I'm there and you're wondering, well, why in the world did they do it that way? You can ask because you're confused and you don't understand, but not to confirm something you already have decided about me and my family. And then, we were talking about evidence-based practice. Honestly reflect on your expertise to support this family. Do you have what they need? And be honest about that. And also, and I think this is a real need in Mississippi, to be honest with your organization. And I know that can be hard, and we probably need to find ways to do this that protect individual employees. But if you need additional support and training to be able to support this family in the way they need, how do we get that for you? And think about how your perceptions might change if this child came to live with you for a week. Because I can guarantee you at some point, if you've given with different things you may have told the family, because I know I've thought this, I've had mostly medical doctors tell me things, and I'm thinking, you take him home for a week and you try that and you see how well that works. It's a very different perception to be living with this child 24/7 than how it might seem when a particular situation is described in your office. That doesn't mean you don't bring a lot and that there can't be things that you can share that would be very helpful, but keep that perception. And consider how you can use your skills to help the systems already working with this child and family, like providing support at school. Okay, and we're going to go through these really quickly so we can get to some of the things at the policy level. What does all this mean at the program level? First of all, just like that definition of family-driven practice, that families and youth should be involved in all aspects of program development, implementation, and evaluation to ensure programs are focused on supporting acceptance and real-world outcomes. Programs should begin with the assumptions of acceptance and goals of helping children and youth have the same opportunities of success as any other child or youth. They're not about getting rid of stuff. They're about helping that child live in the community. Expect systems to use evidence-based practices and adequately train, supervise, and support staff to implement them. That's crucial. I don't know if we're doing that in Mississippi. I have some concerns. And prioritize embedding good mental health practices into the places where children already are. So school, and what do school-based services look like that really support children in school? Pulling them out of a classroom when they're already having trouble with learning probably isn't our most effective first place to start, but embedding really good support into the classrooms is. And there's some interesting models for how schools and mental health partners can partner on that, and also to make sure that children with disabilities still receive the accommodations they need at school. And then looking at how mental health can be embedded into primary care. And a couple of ideas there, just the whole issue of medical homes for every child to have a place, a provider that they can go to that's going to help coordinate all their mental health, all their care, including mental health, whether they're coordinating with another entity or providing it in-house, but all that's coordinated. And one relatively new initiative in the state is CHAMP, and that's a pediatric mental health psychiatry consultation line where any primary care provider, so anyone providing the medical care, it's not for parents or anyone else to call directly, but for anyone providing the medical care, can call this line and talk to a child psychiatrist, child psychologist, social worker, or someone who can help them with resources in real time while that child's in their office. This is free. And say, I'm needing help understanding this medicine or what to do here, and get a consultation. So hopefully that child can continue to be treated by that primary care provider. That primary care provider learns skills they can use with others. That is open and free to any primary care provider in the state, and they can call that number. And you guys will have these slides on our website. You can get this link. Okay, what about the policy level? Now, there's a couple things going on in the state, and I already alluded to one of them, about what does this mean about creating this environment of acceptance at the policy level. So any policy should help children live in their homes and communities, should move in that direction, or help anyone in that direction, and also allow for input of either the people receiving services or their families. So here's a couple things. This is probably the biggest thing that happened. Some new policies came out about Mississippi Youth Programs Around the Clock, which is a program that's abbreviated MyPAC. If you are on here as a family member and are wondering if you've participated in MyPAC, because I know this, because people will participate with us, but not know our name. You can be in MyPAC and sometimes not know, oh, that's the program I'm in. It's a more intensive level of mental health services. And one way you might know if you've been in MyPAC or are in MyPAC is if services are being delivered in your home or somewhere else that's not at a place. That's not the only time that happens, but that's one way. Okay, this is what it is. It's a home and community, and this is all from Medicaid. Medicaid program for children and youth with serious emotional disturbances that follows the high fidelity wraparound process, which is basically a way of providing the care coordination where the family partners on everything and gets input into everything, and it's based on what they say they need. So just like the things, the acceptance type things we've been talking about. It's an alternative to psychiatric residential treatment facility. So it's for children and youth who might otherwise be eligible to be in a place like Mill Creek or CARES, youth villages up in Memphis, Brentwood, not the psychiatric part, but I think they have a residential part. Some of those places. Wraparound is, okay, an all-inclusive planning process that is youth-guided and family-driven. And we've talked about what family-driven means. So it's done should be done in complete partnership with the family. This process is based on strengths-based, and brings community services and natural supports together. So this process of people are in MyPAC should be bringing together a variety of groups in the community to support the family and whoever that family says is important to them, their friends, their family, people from their faith community. And it's a way to help children and youth with complex mental health needs and their families achieve their hopes and dreams. Parents and guardians are much more involved with the planning and implementation of the services provided for their child while in MyPAC. So they have to meet the clinical criteria to be eligible to be in a psychiatric residential treatment facility. So these are children who otherwise would not be able to live in the home. They're under 21, and right now this is just for children who whose health care is funded through Medicaid. These are the things that are supposed to happen in MyPAC. So there's an individual service plan, a crisis plan, and everything's facilitated with that wraparound. There's supposed to be mental health services using those evidence-based practices we talked about, social services, physical health and welfare services, and recreational activities. All of those things should be available. And then other supports and services as identified by the family and child and the family team. So if there's some sort of non-traditional service that the family thinks will be helpful in keeping their child in the home, that is part of MyPAC. So if someone is receiving MyPAC, this is what the person who is the wraparound facilitator and help bring all this together is required to do. They must facilitate a child and family team meeting once a month. So bring together all the people that are working with that family and the child. They must meet face-to-face with the MyPAC participant. So that's the child, at least once a week. They must meet face-to-face with the family at least twice a month. Contacts related to the individual service plan implementation must occur at least 3 times a week. So they should be talking to all those other people on the team and making sure things are working together at least 3 times a week. That's not the family. I mean, hopefully the family would be involved in that, but that's coordinating with all those other entities to say, like, you know, you said you were going to check on this recreational program. Did you get that done? How's that going? And then if they're on medication, they need to see the psychiatrist or doctor every 90 days. And then there has to be quality assurance activities so that we know what the outcomes are. What has happened is the Division of Medicaid is proposing to change the way it pays for MyPAC. Now, right now, there's an all-inclusive rate. So if anything with MyPAC occurs in a day, one thing or a whole bunch of things, that provider organization gets $347.74 that day for providing that MyPAC service for up to 115 days per treatment year. So that's how it's currently being paid for. And because of some changes with legislation, or the legislature has frozen the rates of Medicaid, so they can't be increased this year. And there may be changes at the federal level and how Medicaid, how wraparound will be paid for, or programs like MyPAC. The Division of Medicaid is proposing to change to a different way of paying for this, using what's called targeted case management, and then paying for the additional medically necessary services. So they're changing the payment strategy, the payment methodology. We have talked to Medicaid, and they're saying they're committed to families still getting the same services that they need. There is questions about that because the targeted case management rate isn't necessarily high enough from what people are saying to be able to cover those services. So it's important that that be figured out. What we want to stress, now you may be wondering, is that a fair rate? That $347.74, because that's a lot of money. This is what the residential facilities charge per day. Now, keep in mind that if a child's getting MyPAC, what they get in a day should be similar to what they get at a residential treatment facility. So the supervision, the support, in addition to active treatment, there's a lot more that goes on. So this rate should cover an intensive level of services in that day. Public comments are open now about this policy. And you might think, well, I don't know a lot about all that. I don't understand what she just said about the funding. It's okay if you don't understand all those things about funding. I'm not sure I understand everything. But what I do know, and what I want all of you to definitely consider, is nobody knows what my pack should be like and how it can be helpful more than the families and youth who have participated in it. So we are urging you, if you are a family who has participated in it, or maybe you're someone who's worked with it or knows something about it, to share public comments. And these are some things to consider. If you received it, what did you like? Does it help foster that acceptance? And does it help families and youth reach the goals they identify? Is it based on family voice and choice? Because that's what wraparound is. Is it individualized to each family? Is the full array of services it says it offers, are they available? Can families choose from a variety of providers? That's one thing. Just because like your child was in a treatment facility and then you're offered MyPack, you don't have to have it from that facility. And you also don't have to, if one provider is providing your wraparound services for MyPack, that doesn't mean you can't get your services somewhere else and that they shouldn't be telling you about a wide array of services you can get. Do services and supports happen in the manner and at the frequency the family feels right to the family? Are they coming as much as you want? Are they coming more than you want? Where do you want to meet with them? Some families want to meet in the home, some don't. Is all that working out? And when you think about, especially if you've been in the program, does it seem like it's cost effective? Because it is less than residential treatment facility, but is it, for what you got, does it seem worth that rate? And do the staff have the training and support they need to deliver those services? That is an incredibly intensive service and a lot of supports. So we would want the staff to be well trained and to have a lot of support and backup to do what they do. Do they have it? So those are some things to consider. And then if you want to give comments, this is how you can give it. And then the Division of Medicaid will consider those comments before changing the policy. So one thing we have asked, and I'm going to look at my text because I've been trying to find out the answer to this. Okay, I don't have an answer yet. Some families have asked, if you give public comments, you're going to have to put your name on your public comment. But when they get published, does your name have to be on it when it's published? And we have not gotten an answer on that yet, but we're trying, Medicaid's checking, because there may be like a statute or something that answers that. So keep in mind, nobody has the specific expertise that people actually receiving the service have. If you have been involved in MyPack, you are an expert on your experience with MyPack. That is very, very valuable. You don't have to understand everything about the policy to give feedback. No one should feel pressured to comment or to comment in a certain direction. Those of y'all who are working with families, especially if you provide MyPack, please encourage them to give feedback, but it needs to be done in a way where you share the opportunity that they can give the feedback without sharing an expectation. Remember, even families who appreciate a service likely have ideas on how it can be improved. You don't want to make a family feel like, well, we want you to go be a real cheerleader for what we're doing over here in MyPack, because maybe they have some really good ideas about how it could be improved that they don't necessarily want to tell you. And also, the opportunity to comment should be shared equally with all families. If you have a program, we urge you to just put something out there to every family saying, this is how you can comment. So it doesn't look like anybody's trying to get families who are just in favor of a program or not in favor of it to comment. And we need to reduce perceived and real threats of retaliation, because we've already had that brought up to us, that nobody's going to be retaliated against if they say what they think. This is another opportunity for to think about how we can create a greater environment of acceptance. There is a Department of Justice lawsuit. It's been ongoing for 10 years in the mental health system. And it's about, do people with mental illness have as good of a chance to be able to live in the community as anybody else, because the right kinds of supports and services are provided to them? That has been an ongoing suit for a number of years. It went to trial in 2019, and the state was found in violation of the Americans with Disabilities Act. And then they have recently, they were supposed to submit a plan for how they were going to fix this. And their plan starts out with saying that basically, and this is legal language, but it basically says it maintains that it's not liable. So our state maintains that even at the time of the trial, when the judge found it in violation, that they weren't. They are now saying that they're in substantial compliance with the Americans with Disabilities Act, which would mean that people, and this suit is about adults, but those of you who have children who are like in that 18 to 24-year-old transition age, it applies to them. They're saying now they're in compliance with the Americans with Disabilities Act. That means that people with mental illness should be able to live in the community if they want to and have the supports they need to live in the community, not to necessarily just get rid of their symptoms, but to like live and work in the community. So you can think about if that's true for you and other people or people who might be affected by this. And then it also said the court should therefore not issue sweeping relief that invades the inner day-to-day workings of state government. So even if the court is going to make them change, that it shouldn't be anything that disrupts. And then they have a plan that's about adding services, but it doesn't give us any information about the outcomes that we will see, or how we'll find out if people receiving services find it effective. If you have any feedback about that, these are the people, and again, we'll have these slides on our website, and this is in a blog post too. If you have feedback for the state of Mississippi about what you think about those points, you can call them or talk to them. And I actually talked to them last Friday, and I told them I don't think that's true. I think there's lots of evidence that we're still in violation of the Americans with Disabilities Act. And I don't think people with mental illness are able to live in the community if they want to, from what I've seen and from what our calls would indicate. Not all people, that there's still people ending up in jail and in other places. Now, and then if you have concerns about the United States bringing this suit, or if you want to give the United States information about your situation, you can contact them too. Okay, we went through a whole bunch in a really quick time, and I did not mean to stop sharing. Excuse me, guys. I want to put this back up here so you can see what we said we would do. You'd be able to look at the difference between awareness and acceptance. You'd be able to share ways both providers and families can use acceptance as a helpful way to make services more responsive, demonstrate understanding of how programs can be set up to foster acceptance, be able to describe 2 policy issues in the state related to flipping the script. So does anybody have any questions or anything you want to share? And then there's our information. I know that was a whole bunch, guys. Okay, you will get I think you will get a survey right when this closes, if we got everything set up right, that will ask you to evaluate this session, and that really helps us. And then you will get a follow-up email, and I believe that follow-up email will also ask you if you would, for us, complete a survey. And it's a demographic survey, and it's about helping us see if we're doing a good job equally reaching out to different groups of Mississippians. It's evaluating us, not you. So we're not trying to be nosy about you. We're trying to see how we're doing. And we would really, if you have not responded to that survey, appreciate you responding to it. So thank you. Thank you. Do you have anything to add, Karina?
No, ma'am.
All right. I guess we'll just tell everybody to have a good weekend. Oh, and I am so sorry. I forgot to say AmeriGroup is on here, and I am terribly sorry. I forgot that. We have are very grateful to AmeriGroup. They have supported us and are sponsoring our webinars this month, which is allowing us to do more outreach about what we're doing and getting this information out to more families and more people. And in fact, we're repeating some of this information. One thing we're allowed to do that sponsorship has allowed us to do is we're doing a related webinar with Mississippi PTI this coming Tuesday that will go over the wraparound stuff in more detail and what that should look like. And that would also help families on the public comment. So thank you to AmeriGroup. And I am so sorry I forgot to mention that at the beginning. So much happened that we were adding to this that I didn't get that in there. Okay, thank y'all so much.